Hi, this is Dr. Matusis, and today I'm going to talk to you about fatigue, pain and functional symptoms with an emphasis on how to approach them in order to manage them. And this time I will point you to very useful resources outside these slides that you can benefit from. So, as mentioned, this is a set of two closely related sessions, and please watch them together. Pain and fatigue are different experiences. They may have different causes medically, but they do have also a lot in common, and they particularly have a lot in common in the sort of rehabilitation approach that you can use to manage them well. So, as usual, I'm going to recap and give you an overview of the session, and then I'm going to go into the details. So, in the previous session, we talked about inpatient treatment, or at least usually that's the way that the course is organized, although for some people we may do it slightly differently. We emphasize the roles of physiotherapy and occupational therapy in the inpatient treatment, and we presented you with the environments where the therapy takes place in the UCLH neuropsychiatry department. We talked a fair bit about what's the content of the sessions, what to expect from the sessions, and we suggested some homework that included continuing with your goals in the diary, with your breathing exercises and all you've learned, but also it was also about the thoughts and questions you may have about your inpatient stay. So, in terms of overview for this session, I'm first going to focus on fatigue, and then I'm going to go on to talk about pain in the body, and give you some medical detail about pain. And then I'm going to talk a bit about using the 5 areas approach to manage pain. And for both of these, I'm going to talk about the issue being how to overcome pain rather than fight it or make it completely disappear. And as usual, I'm going to end up with suggesting homework for next time, but this time it's going to be a lot more dependent on what your own situation and needs are and how your own symptoms relate to the topics of today. So, fatigue. Fatigue can be a problem characterized by boom and bust cycles. And what I mean by this is that it's natural on days when one has fewer symptoms in terms of fatigue and exhaustion to be tempted to do all the jobs and activities that we were unable to do on the days when we were just too tired. And what we find is that for people for whom fatigue is a problem, it's easy to overdo it on these good days, and this results in feeling more tired on subsequent days and unable to do as much. So this can set up a pattern of boom and bust of activity, and it may actually cause an increase in symptoms. It's a very common pattern in many individuals who may suffer from chronic fatigue. So here's a diagram. I'm just putting this up to say that I'm going to refer to the height of symptoms as peaks, and the low points where one has fewer symptoms as troughs, where one is sort of booming in their activity, and the peaks obviously is the bits where there's a bust. What we find is that this boom and busts pattern can actually lead to a gradual deterioration over time. So prolonged rest can result in weaker muscles and a drop in fitness. So if you actually get into the pattern of boom and bust, what may happen is that when you rest and the symptoms of the overactivity and the fatigue subside, the body actually becomes stiffer, and in some sense there is too much rest in the same way as there was too much activity. And what happens after that is that pain and fatigue can become easier to bring on. So this vulnerable state of reduced fitness and increased stiffness we call deconditioning. We call this process deconditioning. And the downward spiral, the feeling that things are getting gradually worse, makes people frustrated and pessimistic and think that they're out of control and feel they're out of control with their condition. The downward spiral, therefore, as a summary, is having symptoms, over-resting, then becoming deconditioned, and then experiencing worse symptoms for the same amount of activity. And this can go round and round. So what might be the consequences of this boom and bust cycle? Well, as mentioned, increasing symptoms, body aches and pains, and more fatigue. And again, as mentioned, feelings, unpleasant feelings, thinking of one's out of control. And one very unpleasant thought is that it's impossible to plan ahead because one feels that there's a flare-up coming up if one plans to do different things. And as part of this downward spiral, work or activity or one's role becomes harder to fulfill as fitness decreases. People experience frustration and hopelessness about this, and they start getting also more psychological symptoms. So it's common not only to feel fatigued, but actually to get worse quality rest. So because one is unrelaxed because of the frustration, one is just it's much harder to relax properly. How do people cope with fatigue? Well, many people cope with fatigue by changing the way they do things. Different people reduce the hours that they work. They do fewer enjoyable activities, especially socializing and sports, which has an impact on their mood and their well-being. And they avoid trying to do new things. And they rest more during the day. We are going to approach managing fatigue or coping with fatigue in a different and more systematic way, and the two key things we're going to talk about in the next part of the video is grading, finding the right amount of activity for you, and pacing, which is about planning the timing of activities.